motion. So if I were to spin somebody, what part of my brain do you think I'm activating? Yeah, so when I'm turning, think about that I'm doing a directed stimulation of that vestibular system, okay? So when we talk about a multi-axis rotational chair, it's a fancy tool. We have it. It's expensive. You can do things that like a chair. I never had this. Before I did this, I had to use a chair, right? And so you can use a chair too. So I want to make sure we understand the concepts. But multi-axis movement allows movement in multiple planes. So not only just in rotation, but it allows in what we call roll, right? It allows us to have motion in pitch. It allows us to have motion in pitch and roll and yaw, all the different planes. The reason it's good is because as we can, the more planes we can access, the more robust the signal can be. Okay. So we're activating semicircular canals. Those are those little receptors in the inner ear. Otolith organs, those are my gravitational receptors. Those are the ones that respond to gravity. As I'm standing here, I have inner ear receptors that respond to gravity. You know, it's important to get your patient or loved ones to stand and do things so that they're fighting gravity because it stimulates their brain. The stimulus is graded, repeatable, and direction specific. That's why I like the multi-axis chair, because it's really going at the same speed always consistently. But again, you can use a chair. So this is a multi-axis rotational chair. We can use it in several different planes, but we like to do in an examination is really determine if there's any sightedness to what's happening with them. So we'll put them through different tests using video oculography, special eye movement parameters. So we'll look at breakdown in eye movements. We'll put them on a posturography platform if we can, if the patient allows us. So they're going to stand and we're going to measure different postural changes. We'll do a slew of different tests, reaction time tests on boards to kind of try to really understand where these deficiencies are greatest within that child, or I shouldn't say child because we treat autistic adults too. So within that individual.